Okay, folks, so this week we are going to be talking about chapter 5 and some related articles um, from that chapter. So let's look at chapter 5 here and see what it talks about. Okay, so Chapter 5 is on clinical information systems, essentially. Okay, so what are clinical information systems? They are electronic health records, computer provider order entry systems, telemedicine, telehealth, and personal health records. Now, one of the things that you may have already noted in the first in the weeks previous to this, I talked about electronic health record and personal health records sometimes being used interchangeably. Now, to be honest, it is used interchangeably. The concept is the same. Those both are online records of patients' history, medical history, right from the day that patient was born till present. Now, when we talk about this electronic health record systems, the last 10 years has sort of seen, last 10 to 15 years has sort of seen a revolution. One of the main areas or rather, one of the most significant developments in the last 10 to 15 years when it comes to the marriage of technology with healthcare was the advent of electronic health record systems. Now, what it allows mainly is, okay, it's great to have electronic record of a patient's health. But however, the thing is, what it's the biggest purpose it serves is that health data can be shared by different stakeholders. So, for example, let's say you are visiting a clinic in Beaumont, and you go and see a doctor, and the doctor prescribes a medication or a lab test. So the pharmacy and the doctor can share that information about the medication, about the lab test with the lab, with the pharmacy. So what I'm trying to get at is that electronic health record basically allows for information sharing. Okay. Previously, when there was no electronic health record, everything had to be done manually. Once you visit a doctor's clinic, the doctor, if and when they had advised for a lab test, you would have to send that to the lab. The lab would have to receive it and then take the necessary course of action. Same thing for the pharmacy. Also, think of it this way. Let's say you are in Beaumont and you graduate and you have to relocate to Virginia, right? Now, you have been living in Beaumont for 20-something years. All your data is stored in a specific physician with all your electronic health information has been for till now taken care of by the hospital that you visit in Beaumont, the doctor's clinic that you visit in Beaumont. Now, you have to move to Virginia because you recently got a job. So what happens then? Now what happens is the hospital in Virginia will say, hey, you know what, we have this patient by so-and-so name. We would like to request you to share that person's health information with us. And lo and behold, it can be done within minutes, okay? Because the reason is your hospital in Beaumont, your clinic in Beaumont was storing all your information online, and all they need to do is share that information with the hospital, with your hospital in Virginia, with your clinic in Virginia. Now, of course, there's security concerns here because we are talking about your health data. There's so much confidential information out there, just not your social security or your date of birth, but any medical condition some may have, which not everyone wants to reveal, whether to a friend or an employer or any third party that they do not want to reveal the information. They could have access to the information. Of course, we'll talk about security of healthcare information later, but I'm just giving you a sense of the pitfalls of having electronic health records. Of course, computer provider order entry systems. These are also a new technology that has come about in the last 5-10 years, where all your prescriptions for lab tests, for medications are done online. So again, you visit with the doctor. The doctor advises for lab tests, for your medications. The doctor enters everything, and then that is electronically transmitted to your pharmacy, to your lab that you visit. Also, for example, this information can also be shared with your health insurance company. So, for example, let's say the doctor has advised you for a X-ray, right? And the X-ray costs $1,200. I'm just throwing out a number. If you have insurance, that'll only cost you $50. So, but the doctor has to inform your health insurance company why this X-ray was done, what was the reason, so that the doctor's clinic can be reimbursed by the health insurance company for that X-ray that they did for you or on you. Okay. Telemedicine, telehealth is a concept, remote monitoring of patients. So let's say, for example, you have a patient with diabetes. Okay, the patient diabetes is a chronic condition, meaning that it lasts for from anywhere from 3 months to a lifetime. Okay, and there's no cure for that kind of disease. What we call diabetes, or what people call diabetes, is a lifestyle disease. Okay, so the only way you can improve the health condition of a diabetic patient is to have him or her go on a regular diet, go on regular exercise, of course medication, depending on the equity, the seriousness of the diabetic condition. So let's say that this patient is visiting with a doctor every 1 month, but once the doctor is the patient is out in between patient visits, the clinic, what do? You still want to keep the patient engaged. Remember, we talked about patient engagement. So what you do is, what a doctor does is, he or she, or the care provider, doesn't have to be necessarily the doctor, but could be the nurse physician, sort of make sure that the patient is taking the medication, make sure that the patient is following the treatment plan, the diet plan, the exercise regime that the doctor had advised. So how do they do it? They could probably send them a text message in between visits, every week. Okay, so if the patient is visiting after every 1 month, so following that visit, the next week they can send a text reminder: hey, are you taking your medications? Are you exercising regularly? Are you taking your diet? Are you watching your weight? Are you watching your insulin levels, and etc., etc. So this is basically telemedicine, telehealth, where the care provider is interacting with the patient using some sort of technology that could be as simple as text-based messaging, email, or you could have video conference. You could have at the end, at patient's end, you could have a monitor and a screen. Patient can come online, doctor, care provider can be on his or her side, and then they can talk, interact over video conferencing. So that is also remote monitoring. So there are various ways, and various terms used over the years. Like I said, you can go over this for the EHR, PHR. Now this is definitions of EMR, PHR. So if you look at the definition of EMR, electronic record of health-related information on an individual that can be created, gathered, managed, and consulted by authorized clinicians and staff in one health care organization. Whereas personal health record information on individuals that conforms to nationally recognized interoperability standards. So electronic medical record is specific to a clinic. It's of course both personal health record and electronic health record are the same. They have the same content. They have all the patient's medical history. However, according to this book, electronic medical record is specific to the patient, whereas PHR, personal health records, meets the overall guidelines, overall standards. So essentially, like I gave you the example, when you're relocating from Texas, Beaumont to Virginia, you may have had an EMR. Now, since you moved to Virginia, it's a different state, maybe some different regulations, so the EMR has to be converted to your PHRs to be shared with that hospital or clinic in Virginia. Okay, so that's the basic distinction, fundamental distinction between EMR and PHR. However, people use EMR and PHR interchangeably. I mean even people in the healthcare industry. So you can look at the core functions here. This is an important table. Again, IOM, the Institute of Medicine, defined the functions of EHR. EHR adoption, it has been slow, but now it's picking up because it's a government mandate now. By October, every clinic, every physician, every hospital has to have EHR implemented. And look at this data. Physician adoption, again, it has been slow, but again, it's expected. Now, one of the things that physicians tell me when I interact with them why they don't adopt EHR is that they find it cumbersome, they find it very time consuming to pay the patient, enter patient data. Also, one of the things that we have to understand is the medical profession as such has not been exposed to technology as much as it is being now. So it is expected that the current group of doctors, or the current cohort, if you will, when I talk about current, is the last 5-10 years, they're more technology savvy. As a matter of fact, I have an personal example. I used to visit with a primary care. That doctor was over the age of 60. Now, she wasn't very convinced about using technology, specifically EHR, telemedicine, so on and so forth. It was something of a generational, generational thing. Now I visited with a doctor who's much younger. He's actually less than 40 years of age, and his clinic uses all sorts of technology that are there right now. And he's very comfortable doing that, and his perception is it helps him a lot in his practice. So what I'm trying to make a point here is that you have to understand, when you look at this graph, is that physicians, when they underwent training in their medical school, they're not exposed to technology. They're obviously, their primary focus is to understand how to cure patients, right? EHR, you can look at this, extremely low adoption rates and all that. Value of EHR, talks about value of EHR, major types of, we have already talked about this, CPOE, telemedicine, telehealth. CPOE is driven by patient safety, automates the ordering process, like I said. The historical barriers to CPOE, medication administration, telemedicine, use of telecommunications for direct provision of care to patients at a distance. That's the key, at a distance. Then again, telehealth, personal health record and patient portals. Remember, patient portals are basically where it's a portal, like any other portal, where you can log in as a patient if you have your valid login ID and password, and you can look at your personal health record or any. So, for example, the doctor that I visit, they have an e-portal, and I can log in and look at my recent lab tests, recent visit. What were his I visited with a doctor, and what were his comments on what he saw about my health. So all this, you can log into patient portal, and you can look at your PHR, doctor's comments, results of your lab tests, next appointment, etc., etc. So this is, like I was telling you, there's so many stakeholders in the business of healthcare. So you have this patients, you have people who administer medication, you have labs, you have radiology, you have pharmacy. So there's so many things that have to work together to be able to provide the best care for the patient. And when you talk about technology, how can technology sort of synchronize all these parties, different parties, to be able to communicate the right information at the right time, and then make sure that the patient is getting the best care possible. Then we talk about barriers to adoption. One of the biggest barriers, or one of the most significant barriers, is physicians' perception about technology. And believe me, I've attended conferences, I've spoken to physicians, doctors, and they have said that one of the biggest things that stops them from adopting technology, whether it's EHR, whether it's CPOE, whether it's telemedicine, telehealth, is does it really help them treat their patients, their comfort level, and if is it actually proving to be worth their time to invest the money in technology? Okay. So this is an interesting chapter in the sense that it talks about the various information technologies that are being used. Like I said, look at the table, look at the graphs. It'll give you a sense of what sort of adoption rates, what are the barriers. And of course, we have talked about the key technologies: EHR/PHRs, telemedicine, telehealth, CPOEs. Now let's look at the readings. Electronic health record adoption. I would like you to go over this, and talks about the adoption rates, why it has been as low as it has unexpectedly. But like I said, currently from 2014-15, the numbers are looking good, because again, it's the government mandate that's kicking in, and the clinicians, the physicians, the hospitals realize that, hey, we'll be fine. You know that by October you do not adopt EHR, PHR technology, you will be fined by the federal government, because the first thing, the federal government paid you to implement all this, and then if you're not complying by their mandate, you will be fined. So it's kind of sort of become a if you will, for the people or the physicians, the hospitals who are not willing to adopt this, being a forceful imposition. Whether it's good or bad, well, there is evidence showing that technology is helping patient care, is helping reduce costs in healthcare. So that's something that the government will not change. Okay, they will stick to their mandate. Also looking at electronic health records per se, what they are, and then this is a very short article. It'll talk about what they are, where we are headed towards using. So it says, they talk about Medicare and Medicaid. Remember, I spoke about the CMS, the Center for Medicare and Medicaid Services. Medicare and Medicaid are the one of the most costliest entitlement programs in the country. Taxpayers, it's the taxpayers' dollars. And there's a lot of emphasis on reducing costs of Medicare and Medicaid, which runs up to billions and billions of dollars. And there have been a lot of people who are experts in what they do, suggesting that if you use technology, Medicare and Medicaid patients, not only will they be taken care of better, but we will be able to reduce the costs of Medicare and Medicaid, hence reduce the burden on taxpayers' money. Okay, so this is again an interesting read. Also wanted to touch upon mobile health. Again, it's a part of your telemedicine where you are using mobile technology to interact with patients, access patient data. Of course, before that, there's one more article I would like you to read. It's on the readings. Do EHR investments need to lower staffing levels? It's an interesting read, and essentially, again, you look at the graphs here, you look at the tables here. It'll give you a sense of you get an understanding, and it talks about all the various kind of technologies that the chapter 5 has talked about, essentially, so. The findings of our study should not be okay. So let's look at this. Key considerations for finance leaders is based on our findings for around 3,000 U.S. healthcare facilities. The relationship between EHR use in hospitals and greater labor efficiency measured across all labor disciplines does not appear to be strong. Hospitals greater number of EHR applications and needs do not appear to realize significant gains in labor efficiency as measured by FTE/AOB. Okay, but they also say, these authors also say that the findings of a study should not be construed as casting EHR technology use in a negative light with regard to financial returns. Instead, they should demonstrate to financial executives the need to identify the value of other non-labor benefits that could help hospitals adapt to challenging operational environment. So I would like you to read this. It's kind of a perspective. Okay, they've done a study. It's an extensive study, about 3,000 hospitals. They've taken data and try to understand if EHRs really are providing financial returns. But you also have to understand the limitations of the study. That's why I want you to read that and get a perspective on what they're trying to say. Again, I was talking about mHealth, of course, mobile technology. This is a report by Deloitte, how mobile technology is transferring healthcare. Now, when we talk about mobile, I'll give you a simple example. So if somebody's a diabetic patient and they have a mobile app to track their insulin levels, track how much what they're eating, track how much they're exercising, all this data is a part of your mHealth app, and then you can share that information with your care provider. So the care provider is basically monitoring your progress even during the times that you're not visiting with him or her. For example, I'll give you an example. I have had a lot of people tell me that they use certain mobile apps, that's on a cell phone, iPads, to track their weight loss programs. Okay, and they've said it helps because every day you are filling in information about what you're eating, how much you're exercising. So you're keeping a tab on the calories intake, keeping a tab on your exercise regime, and then it allows you to keep your focus. Okay. you have data in front of you. Okay, so today you ate 3,000 calories, right? You should have been eating X amount of calories, so you are over today. So your mind will tell you, okay, you got to check your calorie intake for next day. So things like that, simple as tracking your diet, tracking your exercise, that can help you. And there's evidence, there's a lot of evidence. So what is driving adoption of mHealth? You can look at this. Let me also tell you that Apple has become one of the big players in mobile health apps. I mean, they're talking about Apple, companies like Apple, Google, IBM, really making huge investments in mobile health area, and coming up with the best applications or software that will allow patients to be more engaged in taking care of their health, allow patients and doctors or care providers to interact with one another remotely. Telehealth, telemedicine. Okay, so read this. It's a report, so it's not that it's just, you can look at the most important figures, the tables, the data. It gives you a sense of where the mobile industry is heading, mobile health app industry in context of healthcare. Then healthcare apps used by doctors. Again, it's a very short article, but it'll give you sort of an idea of like the commonly used mobile apps used by doctors. So for example, Hippocrates, one of the oldest and most established medical app, Hippocrates gives doctors basic information about drugs, the right dosing for adults, children, and warnings about harmful interactions. It's kind of specifically, these apps are for doctors, up to date. And another app, this provides reference materials for doctors can consult when making treatment decisions. Okay, so there's a lot of things going on. Again, I just want to kind of step back and say that mobile health apps can also be used for telemonitoring or telemedicine, because if you have an app at the patient side and you have the same app on the care provider side, and those are synchronized, okay, and you can if the patient is filling in the entry on a regular basis about their diet, their medication intake, and putting it in that mobile health app, feeding that information into the app. That information is being shared by the doctor. The doctor is watching what's going on, and hey, if they see something's wrong, they're off. The patient's off. They're not exercising properly. They're having food that they're not supposed to. They'll probably contact them. But everything is remote. Okay, so that's an application of mobile health apps or telemedicine. Whereas you can have apps that are specific to doctors, that are specific to patients. So they're all over. With that said, hope you enjoy this week's chapter and readings. Again, this is a very interesting area. We're talking about technology adoption. We're talking about how various technologies are adopted for patient care, for better, to achieve better quality of patient care, to reduce costs, and that's what we are trying to do this week. Thank you.